stooping or exaggerated curvature in the upper back that leaves the patient stooped over like so in this region. Why does it happen? What happens? How does it occur? Let's get a bit of an understanding, shall we? So again, as ever, to understand this, we need to appreciate a little bit of the anatomy. So first and foremost, we're referring here to patients, generally females, post-menopausal, and to be quite honest, it's more kind of in the 60-65 years of age and above. And why does it all happen in this female, in this age group, in the social demographics that we speak of? We'll explore now in just a few moments. So the area which we are referring to in terms of the spine is the thoracic region. So here we have again the anatomical model of the spine. We've got our pelvis. This is the front with the patient looking at me. This is the back, and we have a side view of the patient from where you are seeing this. Again, generally speaking, we have the cervical region, i.e. the neck. There are 7 vertebrae there. We have the thoracic region comprising of 12, and we have the lumbar vertebrae at the bottom, which comprises of 5 lumbar vertebrae in the normal anatomical variation. Now, when we look at the curvature of the spine, when we look at it from a lateral view, i.e. side on, the way you are seeing it, what we have is we have normal AP curvature of the spine. AP referring to anterior, front, and posterior, so normal anterior posterior curvature of the spine. And how does that appear? Well, that looks like this in the neck, because we kind of do this, so that's the cervical lordosis. We have this curvature in the back, in the mid-back, i.e. your thoracic region, so your thoracic kyphosis. And just at the bottom over here, in the lumbar spine, we have the lumbar lordosis, which essentially reflects this. This little place here is the back of the head, what we call the occiput. Now, in terms of our patients, what happens is the patient, as they undergo osteoporosis, aging, post-menopausal, once menopause has occurred, we no longer have estrogen being produced. So post-menopausal patients, in the absence of HRT, hormone replacement therapy, what we get is we get the estrogen being removed because it's no longer being produced as part of the normal physiology, and estrogen has a protective factor over bone. And so with the removal of oxygen, we have removed this protective factor over bone, therefore reducing the bone mineral density, which is what we define as osteoporosis. And there is a separate video on osteoporosis explaining exactly why it occurs, how it occurs, and how we measure it, how we assess for it, and so on and so forth. So I'm going to leave that for that one. That's beyond the remit of this one. What we do, however, is in the context of the reduced bone mineral density, we then get changes, structural changes in the actual vertebral body. So these are the stachiovertebrae that are the frontal aspect, the anterior aspect here, which is the weight-bearing part, are what we call the vertebral bodies. And because it's an axial load, i.e. it's kind of gravity pushing down on this, that heavy load that occurs on these, and I'll bring it slightly closer, on these vertebral bodies, essentially what happens is that they are no longer able to carry the weight. And because they're no longer able to carry the weight in the same way, what starts to happen is the frontalmost aspect of this vertebral body starts to kind of curve in, and it starts to drop inwards. And so what you then get is you get a kind of a wedging situation, so that goes forward, and so you get a pointy triangular view, and that's the wedging, so what we call anterior wedging of the vertebral bodies. And now if you accumulate that in all of these guys, what will then happen is you'll get an accentuation of that curve, and that accentuation, it will then manifest in that stooped curve in the thoracic spine, in that region over here, which then looks like they are stooping over, and that is what we then refer to as hyperkyphosis. Now, I know many a time we see individuals referring to kyphosis and saying, oh, you have a disorder called kyphosis. That is not a disorder. I'm sorry, but that's categorically incorrect. As I suggested a moment earlier, this is your normal cervical lordosis, your normal thoracic kyphosis, your normal lumbar lordosis. These are not ailments, this is normal anatomy. Whereas I've seen it many a time being referred to as a pathological, or implication that it is pathological. A hyperkyphosis or hyperlordosis, i.e. an exaggeration of that curve, is perhaps clinically significant and deemed as being non or abnormal. Okay, that in its entirety on its own, again, is not a pathological finding. We have to understand what it is that's causing that exaggeration of the curve, and in most cases we have reason for that. In the odd exception, there is no reason for it. So there you are. It's the decreased bone mineral density on the weight bearing aspect of the vertebral bodies that's causing this stoop, and it's the anterior wedging that's often seen in on an x-ray, on a lateral view on an x-ray, and we can see those changes. And what we also find quite often, quite common, is because of that weight bearing aspect, we get compression of those areas, and that compression is what's led to those anterior wedging and the changes. But we also see elements of sclerosis on the x-ray, and sclerosis, i.e. hyperdense regions or white areas, generally on the ends of the vertebral body, and they reflect some elements of compression fractures, which again are relatively normal in the said patient group. So can we reverse these changes? Well, the answer is we can prevent the progression of osteoporosis, be that by resistance exercises, and swimming is one I personally recommend all the time, or otherwise supplement that with some pharmacological intervention, i.e. alendronic acid and the likes of these kind of things. But can you actually reverse the structural change? Unfortunately, as far as I'm concerned, that's not quite possible. What you can't do is undo the wedging. What you can do, however, is do some swimming, and again, that will not only give you the resistance exercise, because there's a law in the human body which states where you will lay down bone in the line of physical stress, and so what you're doing is slowing down the progress of the osteoporosis and the bone mineral density loss. But what you'll also do is strengthen the back muscles, and the back muscles, again, if you appreciate, if I strengthen the back muscles over here, that'll start to help me to re-establish some of that curvature. So can you reverse it? Strictly speaking, not in my point of view. Should you use the braces? And again, I've done a separate video on that. I don't agree to braces, back braces, unless they are being used very temporarily and very under supervised situations. So that's under strict control, not otherwise. I hope that was useful. Thank you for watching.